Stress can have numerous effects on the cardiovascular system. It's not always a bad thing to be under stress, but repeated stress or high levels of stress for a prolonged period of time has numerous effects on the cardiovascular system. The most prominent ones are elevating the heart rate, elevating blood pressure, increase of stress hormone, and putting some increased oxygen demand on the heart. Additional effects of stress on the heart can cause altered heart rhythms, one of those being atrial fibrillation. Atrial fibrillation is quite prevalent in our population, especially in people over the age of 70. And prolonged atrial fibrillation that people aren't aware of can actually increase your risk of stroke and put a lot of extra tension and pressure on the heart muscle itself. An additional effect of stress on the heart for women is something called broken heart syndrome, because it can cause coronary spasm, which decreases the amount of blood flow to the heart. I think one of the most important things for people to consider stress relating to heart attack and stroke is to realize that just because you're under stress doesn't mean you're going to have a heart attack or stroke. It's necessary to realize that prolonged levels of stress can actually contribute to elevated heart rate and blood pressure, which are the two main contributors to developing stroke and cardiovascular disease. A stroke occurs when people have prolonged blood pressure over time and the blood vessels to the brain get narrowed and they are in lack of blood supply. And the effects of stroke are severe debilitation and increased morbidity and mortality. Effects of elevated heart rate and blood pressure on the cardiovascular system can also lead to plaque buildup in the arteries of the heart. These plaques can actually weaken and rupture over time, causing an injury and a blood clot, and that's what's usually known as an acute myocardial infarction. There are numerous differences in how women classically present with symptoms for cardiovascular disease and how they react differently to stress. Women typically present with fatigue and weakness and not the classic symptoms of chest pain or shortness of breath. So if you are